Oftentimes my patients will ask me, what exactly do you do when you replace my hip? Well, the first thing you have to realize is the hip is a ball and socket joint. So there's a socket, if you can think of it as being a cereal bowl, and then there's a large ball on the top of your thigh bone. So that large ball fits in that cereal bowl, and that's how your hip moves. So what we're doing with the hip replacement is we're removing your femoral head, which is the large ball. We're putting a stem into your thigh bone. We can then adjust the length of the neck, the angle, how large of the femoral head that we use, and that's all predicated on your leg lengths and offset and all kinds of other stuff. We replace your sockets. We put a brand new cereal bowl in, and then there's a liner that goes in the socket. So there's basically 4 pieces. There's a socket or a shell that attaches to your bone. There's a liner that goes inside the shell. There's a stem that goes down your thigh bone. It's only about that long. And then there's a ball on that stem, and that is the new hip joint. They are not connected. That is why we have to put them in of the appropriate tension in the appropriate position. And then as long as you do your things afterwards, and I've done my job, we should have a good result. But that's what a hip replacement means. Now, some people want to know, what can I do afterwards? I just went through that in the other snippet, so to speak. No repetitive running or jumping, but you can have at it. You can climb, hike, walk, lift whatever you want, walk mini marathon, ride a bicycle, play doubles tennis. I let people be very active because, quite honestly, that's the reason you chose to have your joint replaced. If all you want to do was sit around, you could have done that with your old arthritic joint. So that's the reason for that.